from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
All right, Dr. Laura Wilson of Sherwood Family Medical Center is here. We're going to talk about the cold weather and all the things it brings, like dry skin, even nosebleeds. And then if we do get some winter weather, she'll talk about some safety for that too. You're hoping for a little winter
Maybe
weather.
There's a little bit of kid in me too,
yeah,
right?
I think so. I think there is a little bit in all of us. So we'll see. But first, let's talk about the dry skin, because we all have that.
Right. And this is something that I really struggle with. Of course, washing my hands many times a day, using alcohol-based hand sanitizers, that can really wreak havoc on your hands. But a lot of us just all over will get very dry in the wintertime. Some of these are pretty common sense, but I think it's a good idea to kind of take a step back and do a refresher and say, am I doing everything I can?
Right.
So, of course, the most important thing is to use a thick, hypoallergenic lotion or ointment. I really like the Eucerin brand products. Cetaphil, CeraVe, those are all in the same family. Kind of tend to be a little more expensive, not terribly expensive, but not the cheapy, everyday kind of baby stuff. My favorite thing to do for my hands is actually to mix the Eucerin Original with Aquaphor, which is an ointment.
Okay.
And put that on there. I think that works the best. But again, anything in that kind of product line should be helpful.
Yeah.
You can also add bath oils to the bath, and I do this occasionally. You have to be careful. They can be very slippery.
Oh, yeah, when you're getting out.
But that helps trap a layer onto the skin, which can hold some moisture in, so that can be helpful as well. If you get real itchy, a little bit of hydrocortisone cream might help. And the last thing I want to point out is the bath stuff, and I'm terrible about this one. I love to take a long hot bath, but it's actually not recommended. So you want to do a shorter kind of lukewarm bath. That really, really hot water can dry the skin out even more and break that barrier up.
Right. Okay.
Guilty of that one, though.
I am guilty of that one too, when I have a chance to just lay in there as long as I want to. So shorter and more lukewarm baths are better.
Right.
Okay, let's talk about nosebleeds. This is a real problem for some folks.
Yes, and this is just a problem in kids just year round, but especially in the winter it becomes more of an issue because the dry environments, both indoor and out, really damage and irritate the nasal passages. So the first thing to think about is adding a nasal saline gel. And most people have heard of a spray, but they actually make gel formulations now. They're a little bit thicker. They'll adhere to the nasal passages a little bit better and kind of protect those delicate superficial blood vessels that tend to crack and bleed. A humidifier where a child sleeps can certainly be beneficial, and a little bit of Vaseline just inside the nostrils at bedtime can also help too.
That sounds good. And you mentioned the humidifier as well. Good idea. Okay, then if we do get some snow and all the kids want to go out on a sled or something to sled in, there's some precautions to think about.
And maybe I threw this in just to kind of help coax it along, but the official recommendations from some of the big societies like the American Academy of Pediatrics would be that children should be supervised with sledding if they're under 12, which makes sense to me. We should choose to sled during the day, not at night, because of being unable to see trees and limbs and things like that. They actually now recommend that a child wear a helmet. A skiing winter weather type helmet would be preferred, but I think a bicycle helmet would be adequate for most families. This one is a little bit funny. Most people probably hadn't thought of, but we don't want children to wear scarves while they're sledding because it can get wrapped up in the sled mechanisms or even around things and could pose a choking hazard. So just zip that coat up real tight, but let's avoid the scarves.
I've never heard of that, but it makes total sense.
Right, it totally does. And these are all very freak things that could happen, but God forbid it's your child, right? We want to take every precaution we can. And lastly, they do recommend sleds that have steering and braking mechanisms. So that's kind of harder to find, but of course that one's obvious, right? If you can steer, you can avoid a tree. If you can brake, you can avoid a tree. So some things to think about. Hopefully this means we'll get some snow.
She's hoping. She's wish casting, which is what we do sometimes. Yeah, but here in Arkansas, sometimes if we don't have the good sled, we'll use whatever.
Right.
You know,
I've been guilty of cardboard sledding. My husband specifically.
We are too. Okay, I can't let you go without asking about the flu, how we're doing. Can we still get the shot? Would it still help?
Get the vaccine still. And the flu is bad right now. Almost every other kid I'm seeing is the flu.
Really?
Now, thankfully, I've not seen a lot of complications from it. We've had a couple. But I think nationally, the complication rate is looking a little higher than average. And even the death rate from the flu this year is looking like it's going to be higher than average. Flu vaccine takes a couple weeks to kick in, and we expect to see it probably into February or even March. So, yeah, go get it for sure.
I think people who've already had the flu shot have asked, do I go get another one? Would that help, or does it?
Typically not. If you're a child getting the flu vaccine for the first time, they do recommend 2 doses of it. One thing people bring up a lot too is they're saying, well, the match isn't very good this year. And some years it can be as low as 20 to 30%. But you know what I tell people? That's better than 0. You know, it's kind of an insurance policy. And if you have a 20 to 30% chance of not getting flu or not getting serious complications from the flu, why would you not even do that?
You mean matching the vaccine to what bug is out there?
So, for example, if you get the flu vaccine, you still could get the flu. flu.
Yeah.
It's not always a perfect match, but what we do see is that you do have a decreased complication rate and a decreased death rate in people that get the flu after vaccination.
Yeah.
So it's not a 100% thing, but it helps for sure. And
Totally.
ideally it prevents it, but even if it doesn't, I think there's still benefit
It's not
there.
as bad of a case
That's
all
right.
the time.
That's
Wash
right.
your hands, right?
Oh, yes, yes.
Even though that
yes.
goes back to dry skin right now, where we started, but
Right.
it's still one of the best preventatives.
Oh, for sure, for sure. And cleaning surfaces, if you have a child in the home, you want to hit it with some good antibacterial alcohol-based wipes, because
Okay.
the virus can live on the surface,
Yeah.
right? And so then if a child has sneezed and then you go touch that surface and touch it to your face,
Yeah.
you
There
can
you
get
go.
it that way as well.
It has spread. All right. Well, we want you to stay healthy for the rest of the winter
That's
months.
right.
She wants some snow. We're going to work on that. Thank you for coming.
Thanks.
We want to mention Sherwood Family Medical Center, of course. There's the information for you. If you have some sick kiddos, you can always go right there and get some good help. Thank you,
Thanks,
Dr.
Melinda.
Laura.